This is Switzer Network News. Diesel-powered vehicles are a significant source of pollution, impacting health and contributing to climate change. Ditching Dirty Diesel Collaborative, together with the Pacific Institute, is working to reduce the impact of this pollution on low-income communities.
One of our key messages has been that we either pay at the front end or at the back end of the process, because if we cite housing and sensitive land uses next to sources of toxic pollution, people are going to get sick, and that means our healthcare costs are going to go up, and that's going to affect everyone. We just don't want people to have to pay with their health when we could be doing something to prevent the health problems from happening.
And there are a number of approaches the Dirty Diesel Collaborative is taking to reduce diesel pollution in the region.
One is to get land use planners to use healthier siting practices for building new housing, schools, parks, and other places where people who are most sensitive to that pollution are going to spend a lot of their time. Another is to install zero-emission technologies in diesel trucks and ships and trains so that they reduce the amount of diesel pollution that they're emitting in communities adjacent to those uses. We're also working to establish new designated truck routes that reroute diesel trucks away from sensitive land uses and residential areas to minimize exposure to that pollution.
And the collaborative is making sure that public health is on the radar of decision makers.
So we've met with regional planning agencies like the Metropolitan Transportation Commission, which is responsible for developing our region's transportation plan and determining how transportation monies will be spent. We succeeded in getting criteria included in the funding that they're going to be providing to counties and cities to implement our region's plan to consider health in terms of the areas they're proposing for infill development as part of their plan to reduce greenhouse gas emissions in that county. So it's a way to provide incentives for cities and counties to address healthier infill development.
And Catalina says it is surprising that there continues to be a striking disparity between the environmental health of poor and more affluent communities.
There are many ways we could be breaking from that historical pattern of kind of relegating people with the least amount of privilege next to sources of toxic pollution. I'm really passionate about the impacts that air pollution have on health because a lot of members of my family have suffered from cancer, and they lived in very close proximity to major freeways with a lot of diesel pollution. I'm really committed to making sure that other families and communities don't have to suffer with that doubt of whether something could have been done to avoid that, because there are many things we can do to avoid that.
And our thanks to Catalina Garzon, 2005 Switzer Fellow. To learn more about Catalina's work, please visit switzernetwork.org and click on the News tab. I'm Jerry Kay.